Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. On this edition, we're taking a look at IDPH and its academic partnerships and how we work with institutions of higher learning to advance the field of public health. We are joined by the director of IDPH, Dr. Vohra, along with Dr. Wayne Giles, Dean of the School of Public Health at the University of Illinois, Chicago. Thank you both so much for joining us.
Great to be here.
Thanks so much, Jim.
Dean, let me begin with you. Tell us a bit about your background and what led you to your leadership role at the School of Public Health at UIC.
First of all, thank you for inviting me. It's great to be here with you all today and for the partnership with the Illinois Department of Public Health. I came to UIC about 7 years ago. Prior to that, I'd been at the Centers for Disease Control and Prevention. While at the CDC, I led a number of very diverse divisions, including the Division of Population Health, the Division of Adult and Community Health. All of them had a very diverse portfolio, but all were very much focused on health promotion and the prevention of chronic diseases. We also led a number of groundbreaking projects with communities across the country to address racial and ethnic disparities in health. During my time at CDC, I was particularly interested in educating the next generation of public health leaders. And I participated in a number of mentorship programs for both high school students and undergraduate students, exposing them to careers in public health. So the move to UIC 7 years ago was really a natural next step in my journey as a public health leader. UIC has a unique role in Illinois, being the only fully accredited school of public health in the state. We are the largest trainer of public health workers across the state. So if you go to the state health department, Chicago, Cook County Health Department, Kane, et cetera, you're going to see our graduates working in the health department. That's something we're extremely proud about. We're also really proud about the diversity of our student body. In fact, our undergraduate program is majority underrepresented minority students. Almost 60% of those students are Black and brown students. So overall, it's really exciting opportunity and legacy to be able to lead the great school of public health at UIC.
And Dean, as you noted, we'll be talking in more detail about some of these specific programs coming up. But before we do that, Director Vohra, let me get your perspective on why these types of academic partnerships are so important to the mission of IDPH.
Well, Jim, in many of the conversations that we've had at This is Public Health podcast, we know that public health is a team sport. And it is something very true to the fact that the work that the Illinois Department of Public Health and our local public health departments, they can't do that without the rich, robust partnerships that our academic institutions bring. Very much directly tied to our school and programs of public health, but also how much public health touches many different sectors in which we are so fortunate here in Illinois to have such leading premier institutions that are educating the next generation of public health workers, doing incredible research and being innovative leaders around how we take those next leaps. We're really thrilled to have the opportunity to have at our disposal interns that come from many of the universities. We are fortunate to have partnerships with a lot of the faculty. And it really, I think, is a testament to knowing that these partnerships and ties really allow us to expand the workforce, think differently about what the current challenges are and what opportunities the state should be investing in moving forward. And then also allow, I think at times, the deep critical analysis that is needed to ensure that the work that the state is doing is serving our residents in the way that it needs to. We know that that takes time. It takes really deep and bright minds. And it's something that we need to foster and grow moving forward because the state can't do its work without those meaningful academic partnerships and all they bring to making sure that Illinois is as healthy and its residents are as healthy as possible.
That's a great segue into some of these specific programs. I want to start with a 5-year project called Strengthening Illinois' Public Health System and Workforce. Dean Giles, tell me about the work your team is doing on this important project.
Before I do that, I do want to spend a few minutes just talking about the public health workforce, because I think it's important that we ground the work that's happening here in the state of Illinois. But across the country, it's estimated that we're going to need about 80,000 additional full-time public health workers in the U.S. In addition to that, we've just been through a pandemic, and I think COVID-19 really demonstrated that the public health system, unfortunately, has a limited capacity to respond to ongoing and emerging public health threats. I think because of some of the burnout that's been associated with the pandemic, but even before that, there's been a lot of burnout. It's been estimated that between 2017 and 2021, about half of the public health workforce at state and local health agencies are leaving their jobs. So really what I want folks to take from this is that there's a real need for public health workers. The CDC earlier launched a leading nationwide effort to boost the gaps in the public health workforce. It was a public health infrastructure grant. There were 100 grantees, including the Illinois Department of Public Health, all focusing on sort of building the public health system and the public health workforce. And the Illinois Department of Public Health is partnering with the Policy, Practice, and Prevention Research Center, we call it the P3RC, at the UIC School of Public Health. And in addition to IDPH and UIC School of Public Health, there's a third really important partner in this work, and those are local health departments across the state. There were really 4 overarching objectives. Number 1, identifying the capability and capacity at the state and local health departments. Number 2, to develop a statewide strategic agenda for systems and structural innovations. Number 3, implementing workforce development approaches to address needs. And number 4, formulating a sustainable funding approach to address capacity needs. So we're really excited to be working with IDPH and our colleagues at local health departments across the state to build that important workforce infrastructure that's so widely needed. And I think it's going to be really exciting to watch the work that will happen with IDPH over the next several years as we continue to engage in this work.
I think what we're really sort of setting a course for in this partnership between IDPH, UIC School of Public Health, and the local health departments is the recovery from the pandemic. As the dean mentioned, right, 50% of the public health workforce left between 2017 and 2021. The COVID-19 pandemic had a lot to do with that. But in that health affairs study that the dean is quoting, part of that is that nearly 75% of those individuals left were under 35. It shows that the need to transform is now, to create a bench along the way of people who come into this work, who stay meaningfully into this work, and that the solutions can't just happen at the federal level or at the state level or the local level. They require that deep partnership. And I was thrilled during April and during sort of a 30 days of public health celebration as we launched that transformation initiative with the partners at UIC School of Public Health to really know that we had built and reimagine a new system that required that partnership, thinking differently about how people come into this work and stay into this work. And that's a place where deep and continued partnership with our academic institutions are critical, because we have to create the right pathways. To the dean's credit and his leadership, really making sure that we bring people from communities who have not had those opportunities into this work and really know and describe how fulfilling and rewarding being a public health staff member leader really is. But it's also about the air we breathe, the education we get, the transportation that we have, and often the other kind of critical social services that we receive. There's often this saying that in public health communities that what really defines somebody's health is as much the things that happen within the four walls of a clinic and hospital as what happens outside of it. The things that really we think about in how we live, work, play, and really interact with our communities, those social and structural determinants of health. So that if that is the case, the solutions that we are thinking and needing to create to make sure that we're healthy require intersecting and interacting with those other sectors too. Really a health in all policies and a health for all policies, so that we are making sure that we have the conversations that cross different sectors, because our goal is to make a healthy person and a healthy community in which interfaces with all of those things. And it's been a real treat and pleasure to work with Dean Giles and the UIC School of Public Health leadership to bring together individuals across those sectors of government and in our communities to really advance an agenda around how we can really think about health in all policies. And I'd love for the dean to sort of talk about how this work has started and some of the specific focus areas we've paid attention to in the early years of this work.
I want to bring back a couple of themes, Director Vohra, that you mentioned earlier. I think number one is the fact that public health can't do this work by itself and needs partners as part of the work. I think about when we were going through the pandemic and we were seeing, who was suffering from COVID and who was not. And we saw differences depending on where people lived, where they worked, their level of education, et cetera. That was sort of part of it. And so as we think about this important work, we need to be thinking about sort of how do we change many of the levers in those sectors around education, labor, healthcare, et cetera. And so through this Health in All policy, we are convening all of the important leaders of state agencies, but also local health departments as well. And they're all coming together to discuss specific issues. We review the health and well-being of residents across the state of Illinois and use that to decide specific areas of focus. And so initially we were focused on issues around racial inequities in health, and that was what our first report was focused on a couple of years ago. More recently, we've been focused on the unhoused, and largely because the unhoused is an issue that transcends the entire state. It impacts urban communities and rural communities likewise. There's been lots of efforts around this, but sort of having all of the state agencies coming together, thinking about the unhoused, but also with a focus on health and the public's health and well-being has been an important strategy. And we released our report last December. But each year we focus on a different area, a focus area, one of those very important social determinants of health that Dr. Vohra mentioned, and then we release our report every December. But I will say it has been exciting to be able to partner with IDPH and all of those state agencies on the Health in All policy work. It's also a great learning environment for our students as well, sort of to be able to engage with leaders in all of these state agencies, but it's all focused very much on how do we improve the health and well-being of residents of the state of Illinois.
Unfortunately, we're nearly out of time, but I'd like you to each take just a moment to talk about what this means long-term for the average Illinoisan and their ability to access important public health services and information. And Dean Giles, let's begin with you.
Yeah, so I think long-term, what I hope we see is because we're changing levers, not just within the public health system, but changing levers in education, in labor and employment, around poverty, around healthcare as well. Because we are changing all of those levers, what the average resident of Illinois should see is improvements in their health. When you look at sort of how Illinois does across the nation, we're basically, in terms of life expectancy and other, we're right in the middle. And I think part of what this effort is about is how do we make Illinois the healthiest state in the nation? And I think it's something we can do, but it's going to be through this partnership, through these state agencies coming together, working with state and local health departments and others, that will see improvements in everyone's health.
Director Vohra, if you can give us your thoughts as to these efforts and how they translate from the halls of academia to improving the life and health of Illinoisans every day.
Jim, I think with the health and all policies work specifically, it's really another testament to the governor's leadership around the coordination of state government services. We all have often our different pieces of society that we're working to accomplish, but the power, as we started, of public health being a team sport, that bringing all of these aligned so that we're not treating somebody's transportation issue or education issue or health issue. We're treating the issue of the person and the community. And that's incredibly powerful for health. And more deeply, part of the partnership between the halls of academia and often as people sort of talk about the bureaucracy of government is how do we turn those different sectors of society together into a partnership that helps the efforts and really helps the health of our residents. The partnership between the UIC School of Public Health and the Illinois Department of Public Health is just one example of how those relationships are being utilized and served. So at the end of the day, the health of our residents in Illinois are improved. And as the dean said, that we're really striving to make Illinois the healthiest state in the nation.
Important programs with the promise of long-term dividends for the people of Illinois. Thank you for being here for this important discussion, Dr. Wayne Giles, Dean of the School of Public Health at the University of Illinois Chicago, and Dr. Samir Vohra, Director of the Illinois Department of Public Health. Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.